Well, good morning, good afternoon, or good evening, depending where you are. Thank you for joining us, and welcome to our Global Health Tuesday webinar entitled Advancing Global Health with AI. My name is Jorge Osorio, and I'm the director of the Global Health Institute at UW-Madison. And in today's session is part of what's our monthly Global Health Tuesday webinar series, featuring researchers and practitioners from University of Wisconsin-Madison and around the world. Our webinar series highlights and discusses the complexity of global health challenges and the many kinds of expertise needed to address them. And at UW-Madison, our foundation starts with the Wisconsin idea, a practice which takes knowledge and research out of the classroom into real-world settings. And today's discussion is, to me, really exciting and extremely important about the world of artificial intelligence and its impact on global health. As we continue to confront global health security challenges, the need for collaborative research and knowledge sharing has never been greater. This timely discussion helps raise awareness of the opportunities and challenges working with artificial intelligence. So before I introduce today's speakers, a couple of quick housekeeping items. We are recording today's session, and the archive video will be available on our website. And we're also monitoring the chat, so please put your questions and comments for the panelists there as well. And without any further ado, I'd like to welcome Tom Erickson. And Tom is the founding director of the School of Computer, Data, and Information Sciences, and the Executive Associate Dean of Strategy and Innovation for the College of Letters and Science at the University of Wisconsin-Madison. In 2018, Tom co-chaired the UW-Madison Computer Science Working Group, which focused on the future of computing at the University of Wisconsin. He co-authored the group's report, Wisconsin in the Information Age. This led to the formation of UW-Madison School of Computer and Data and Information Sciences 2019, which brought top-ranked departments of computer sciences, statistics, and information school. And we are very excited seeing the building going up here at UW-Madison. Tom also serves on the board of emerging tech companies in North America and Europe in the areas of data science, analytics, and digital health. So, Tom, thank you for joining and being willing to moderate the event. We also like to welcome Juan Caicedo. Juan is an assistant professor of biostatistics and medical informatics at UW-Madison, and is also a biomedical imaging investigator at the Morgridge Institute for Research. His lab work is focused on creating computational models for phenotypic variation using microscopy imaging and machine learning. These computational models enable them to study the impact of diseases and the effects of treatments at the cellular level, bringing precision and sensitivity to biological research. And finally, we also welcome Rob Nowak to our panel, and Rob is the Grace Wava Professor of Data Science and Kit and Jane Nosbush Professor in Electrical and Computer Engineering at UW-Madison. His research focuses on signal processing, machine learning, optimization, and statistics. Welcome to you all, and thank you so much for being very willing to participate in this very exciting webinar. And I'd like Tom to lead the discussion. Thank you, Tom.
Well, thank you, Jorge. Greetings, everyone. Good morning, good afternoon, good evening, wherever you are. It's exciting for me to be here. It's an exciting time around health and computing, and I'm very, very honored to be joined by Rob and Juan today to talk about this. We're going to kick off first by having each of our esteemed panelists give a short presentation about their work, and I encourage you to enter questions into the chat. I'll be monitoring that together with Jorge, and we would like to make this as interactive as possible. So after both of our panelists kind of present their work, then we'll move into sort of questions and answers, and hopefully have a great dialogue. So starting off with you, Rob, go ahead.
Sorry, who's going to start? I missed what you said.
You are, Rob. Yep.
Oh, okay, perfect. Yeah, great. Thanks,
Yeah.
Tom. Okay, let me share my slides here. Hi, everybody. My name's Rob Nowak. I'm a professor primarily in electrical and computer engineering, but I've got some appointments in some of the other departments. around campus too. And my research focuses on machine learning and artificial intelligence, both kind of the basic fundamental science behind these technologies and then also applications. And I've been involved with a bunch of folks across campus and different applications related to medicine and health. And so I'm going to tell a little bit about that. But I wanted to start off by just kind of, I found in the Sunday paper here, this article, AI is ready to lend doctors a hand. So I think everybody knows that artificial intelligence is here. We're all using it, whether we know it or not, every day. And it has a huge potential in healthcare and medicine. And, this article talked about some of the ways AI systems are able to help doctors. I think they have a great possibility for making doctors' lives a little bit more manageable, so they don't have to do so much busy work after they meet with patients. They can instead focus on meeting with patients and talking with them. That's what they covered a lot in this article. But here are just a list of all the different ways that AI might have a big role to play in healthcare. Disease diagnosis and prevention and prediction, treatment and personalization of treatments, discovery of new drugs that can be life-saving, just improving overall healthcare efficiency, remote patient health, monitoring and telemedicine. And then at a kind of broader kind of societal scale, we have things like public health and epidemiology. Of course, machine learning, statistical analysis, and AI already played a role during the COVID pandemic. So we've seen that as an important kind of part of our healthcare system. And then, we also have issues surrounding equity and access to care and ethical and privacy concerns. These are both opportunities where AI could help, but also places where we need to be a little bit careful and make sure that if we do build AI systems into our healthcare, we make sure they're fair, equitable, private, safe, etc. So what I'm going to do is just talk a little bit about a few of these areas where some of my research has actually touched on, and those are these first four. And I'll kind of just go through them just to give you a little sense of where I see some of these AI technologies helping out. All right, so first of all, in disease diagnosis and prediction, one problem that we worked on with an NIH-funded center that we had here on campus was trying to use the wealth of information that's stored in electronic healthcare record systems. So you may have heard of every patient has a health record that's in a database somewhere. And so if we looked at all of that information collectively, again, in a secure and private manner, so we're not ever leaking any private information about people, but we can use AI technology to analyze all of these health records and then try to see how we can use health records to make better predictions about, are you likely to develop a disease? Is a particular medication helping in your kind of situation or not? And that's what one of the projects we worked on. To get started on this, though, an AI system needs to be able to understand how to interpret these electronic health records. And that's where human experts are a crucial part of the overall engineering design process for building AI systems. And that starts off by taking human experts. These are clinicians who are trained to read and interpret electronic health records, and they need to provide some ground truth kind of labeling and annotations of these health records so that then we can turn it on to what we call a machine learning algorithm. And that algorithm takes these annotated electronic health records and then learns to be able to label and annotate them the way the human experts were doing. And that, at the end of the day, that output of this is an AI system for doing this kind of diagnosis and prediction. So one of the challenges here in engineering is that this can be expensive. These human experts don't, that we need a lot of label data to train up our machine learning system, our AI system, and human experts are costly and time consuming. And so what we've used is AI systems that help us, and let me see if there it is, that basically an AI system itself is saying, oh, okay, what electronic health records am I confident about? the AI system thinks it knows what the right annotations and labels are for some electronic health records. Others it's a bit confused about. And so then the AI system itself decides which electronic health records it would like these human experts to label for it, so that it can learn to mimic the human experts more quickly and with fewer examples. So that kind of reduces the burden on these human experts in this AI system design process. So this is just an example where we looked at kind of predicting cataracts and eye disease using about 11,000 patient records. And what you're looking at in this graph is on the x-axis, the horizontal axis, that's how many labeled examples this AI system was given. And then on the vertical axis, we're looking at the prediction error of the AI system. And so you can see as you get more examples, to train this AI system, the prediction error goes down, eventually close to zero, which is what we want. We want the AI system to do the right classifications. There are two curves there, a green one and a blue one. And the green one is the performance if you just had that original sort of process where basically we're asking our human expert to label electronic health records that are pulled out at random from this pool of records. And the blue one is the one where we're using the AI system itself to select which examples the human clinician should be labeling in order to teach the AI system. And you see that that's performing better. In this picture here, we have about a 60% reduction in how many examples the AI system needs to have humans label in order to get a very good prediction system up and running. So that reduces the burden on those human experts that are in this loop. And one of the kind of interesting things here is that one of the top sort of features that this AI system found that was useful for prediction of cataracts-related diseases was a particular medication, Pepcid. And this wasn't something that I kind of expected. I'm not an expert. I looked it up later, and it turns out that this is a particular medication that has some sort of demonstrate connection of a causal link to cataracts. And so it sort of discovers things that an expert would know, but maybe your average person wouldn't know. So it can even illuminate some of the issues surrounding interactions between different medications and treatments and different diseases. So that's one example. Another one that I highlighted on the first slide was personalized medicine. And so kind of broadly speaking, traditional medicine, we design one model for the whole population, and we say, okay, well, if we have to have one model and one type of treatment or procedure for the whole population, which would it be? And that gives us the best procedure or treatment on average. And as we all know, the problem is everybody's different. And the treatment that might be best on average for the population as a whole might not be the best one for you. So we'd love to have a specific model and a specific treatment designed for each individual patient. And there's a challenge, though. When we find the best treatment overall, of course, we're doing large studies where we try out different treatments on subject pools and we see which one works best. That gives us a lot of data to make sure we're making the best decision about the best treatment on average. But when we're looking at an individual, we don't have so much data. We have a small medical history for that person. And so we don't have enough information from that person alone to be sure about what treatment to go with all of the time. And so the idea here is that what we're going to do is build AI systems that are designed to kind of comprehend those general traits that are common across the whole population, but then also be able to take that individual patient's medical history and then modify and adapt the treatment to come up with the best type of treatment for their individual situation. So you can think of this as sort of combining the wisdom of doctors who are working and talking to individual patients with AI systems that can look holistically at all of the data we have over the whole population, but also individual information for that patient and get personalized diagnosis and treatment plans. Another area that's really active here on campus is AI accelerated drug discovery. And the basic idea here is that you want to find drugs that can bind or couple with biological molecules like proteins or enzymes in order to kind of modulate their activity and combat disease. So you might want to find, for example, a drug, which is a molecule that will kind of repress a certain enzyme that maybe is part of a disease process. And so in order to figure out and discover these drugs that will have these therapeutic properties, we need to see if the drugs will indeed kind of interact or bind with the target proteins or enzymes that we're trying to deal with. So we do that, and you can do systematically studies. So this kind of image that you're looking at below, on the horizontal, we have the drugs that we're trying out, and on the vertical are the different targets arranged in a matrix. So each little dot in this matrix is a drug target combination. And if you see a bright spot like bright red, that means there's a lot of interaction. And if it's dark blue, that means there's no interaction. So we're looking for the drugs that are binding and interacting. Those would be the bright red ones there. So as I said, systematically, you can just go into the lab and try out all these different combinations. Here, it's like 200 and 350. In reality, it might be millions of different combinations that we would be looking at. So this is just a small snapshot of what we might actually be interested in. And the way AI comes in here is we might, instead of testing and measuring all those different combinations, we would test and measure a small subset. So that kind of column on the left and at the top that I'm showing you, we run those experiments. Then given that information, we use AI systems to try to predict the rest of the interactions without actually having to go in and measure them. And so what actually happens is you would do this, you'd use AI to predict these interactions, and then if you see some promising drugs in that gray area there, then you would go in and test those to make sure that the AI system was right. But this gives you a way to kind of screen all the possible experiments you might run to try to find the ones that would be most promising. And then as my final example, I want to look at healthcare system efficiency and safety. And there's a lot of ways that this could manifest, but I'm going to talk specifically about how AI can accelerate imaging technologies and also make them safer by, say, using lower X-ray doses. And I'm illustrating that here with MRI, magnetic resonance imaging. When you put a person into an MRI scanner, it takes, some number of minutes to create, for example, a brain scan. We'd love to make that whole process faster. That would reduce patient discomfort. It would actually increase throughput through the system, making the scans less expensive. So we could offer them to a wider set of people, making the whole technology more affordable and available to a wider set of people across the world. And one way to do this is to say, well, can we devise some method for fast scanning, which reduces the time and cost of these scans? And if you do that, and you just go ahead and say, well, we'll sort of speed up the scanner. If you speed up the scanner, but then use traditional methods that take that data from the scanner and reconstruct an image of your brain, you get pictures like the ones I'm showing you here. So all sorts of artifacts and problems. Now, where AI comes in is you can actually use those fast scans, but then use AI systems that are trained to see how the information in the fast scan data actually correlates and relates to the brain images that we're interested in recovering and reconstructing, and get near perfect reconstructions, even from these fast scans. So I won't go into more details about that, but the whole idea, again, is to make the scans less expensive, less time consuming, and in some cases actually safer by reducing X-ray dosage, for example, in CT imaging. All right, so my last slide, and then I'll turn it over to the next person, is a little bit of a word of caution. I think everybody knows and has heard about potential dangers, limitations, and other issues that could come up with the use of AI in all sorts of places in society. And I just wanted to show you one that kind of relates a little bit to the imaging problem that we were just looking at. So this is kind of a neat paper by some people I know at University of Illinois. They were looking at AI systems that generate images. And we all know, we've probably seen them, AI systems can generate these very realistic looking images. And it's to the eye, they look great. But what they showed in this paper is that many of the basic kind of physics of these scenes don't agree with reality. For example, the lines of sight, if you look at some of these rooms or urban scenes, they look realistic to us, but if you actually check the physics, they don't agree with reality. And so while these superficially look great, they're missing something fundamental about the physics of the real world. And that might be okay if you want to just generate a cool looking image, but it's not good if you're using these systems to help you reconstruct somebody's brain. We want to make sure we get it 100% right. We can and we will, but there's still ways to go on all of this. So AI is coming along. We're learning more about its strengths and weaknesses. We're fixing those weaknesses. We're making them safer, fairer, more ethical. And I think we'll hear more about that today, but I'll stop there and happy to turn it over and take questions now or later.
Thank you, Rob. We're going to move over to Juan and let Juan present as well. We'll come back to questions. So I do encourage our participants to put any questions into the chat, and I'll be noting those together with our hosts, and we'll come there. But without any further ado, Juan, please go ahead.
Sorry, I couldn't unmute my microphone. So good morning, everybody. It's my great pleasure to be here today. Thank you so much to the organizers for having us here, and thank you, Robert, for that wonderful presentation. What I want to share with you today is kind of a perspective on why we need artificial intelligence in healthcare, and the perspectives and opportunities that we have ahead. So my name is Juan Caicedo, and I am an assistant professor at the Biostatistics and Medical Informatics Department, and I'm also an investigator at the Morgridge Institute. So let me start with this study case. A few years ago, a patient with metastatic breast cancer was diagnosed having, a lot of tumors all around the body, and the doctors observed tennis ball-sized tumors, which was, a very advanced stage of cancer. So after many types of treatments, they give her only 3 months of life expectancy. And the options were limited, and she was fighting as much as she could in terms of being available for treatments and even for experimental treatments. So the investigators offered her an experimental treatment, which is called immunotherapy, in which they reprogram the immune cells of the system in order to tackle and destroy cancer cells. This was experimental back in 2013, 2014, when she received the treatment, and the doctors didn't know if it was going to work. Fortunately, the patient fully recovered after 22 months of treatment. All of the tumors disappeared. So we see here in the screen some of the tumors that were present in her body before, and after the treatment, all of them have been, removed. There is no surgery that can help in this case because the tumors were spread all across the body, and it was only with the help of, the immune system, reprogramming the immune system to identify and recognize those tumors, that she had another opportunity. This case was reported in Nature Medicine in 2018, and the patient has another opportunity to, live and enjoy life, thanks to the advancements in molecular biology, cellular biology, and cancer biology as well. One of the reasons the treatment worked for this patient, and I think she was the first patient to be cured from cancer, from a metastatic cancer of this advanced stage, is that she was lucky to have some of the mutations that have been studied for a long time in cancer. So It took a long time to figure out how to reprogram the cells for that mutation, but it was successful because we knew a lot about it. However, there are many other patients that have new cancer mutations that we still don't understand completely. And at the same time, those treatments are very expensive, and those treatments are take a long time. So even though we're getting there in terms of personalizing the treatments for individual patients, there is still a long road to go in order to provide this type of opportunities for more people. And turns out that a personalized medicine of the type that this patient received is really a combinatorial problem. Because it's it's deeply personal in terms of the genetic makeup of the tumor and the person, their age and their living conditions and so on. And on the other hand, we have a chemistry, and there are a lot of treatments, and there are a lot of opportunities to maybe help the system in certain ways. And we also have many diseases that need to be treated and that require attention and advanced type of treatments. So how to choose the right combinations of treatments for the specific conditions of the patient, for the specific disease, and so on, is a very complex problem. And we are making progress kind of slowly in understanding each of the pieces together. If we count, the number of genes in the human genome, we have 20,000, and the number of mutations per gene can also, span hundreds or thousands of mutations. So it becomes a really large space of search, and we cannot do one, mutation at a time. We really need to tackle this in a more systematic.
Oh, I'm sorry. Can you hear me here? Okay, great. So we need more systematic ways of tackling these problems, and this is where we believe artificial intelligence can help. On the other hand, cellular and molecular biology are very complex subjects, and they, span a lot of knowledge that has been collected. And we also believe that there is a lot of structure behind not just the genetic makeup of humans, but also in the phenotypes that we express at the cellular level. And all of that is a lot of information that we're just starting to capture more systematically as well. So the question, that we researchers and scientists working on this field of artificial intelligence for health care and biology, the question that we ask is how we can use AI for advancing those types of pressing problems in a more systematic and efficient way. Turns out machine learning has been very successful so far, and the types of applications that we see involve natural language processing and those, chat bots that we see responding very accurately to a bunch of different tests and questions, or image recognition, in which we can recognize objects and even construct self-driving cars and so on. That type of machine learning has been a success for commercial applications or internet applications, and making sure that those work properly and accurately and safely for healthcare is a very important research problem. Fortunately as well, there are many initiatives at UW-Madison in which we are investigating, several of those problems, including genomics, proteomics, imaging, natural language processing, biostatistics. This is just a subset of the, people working in campus. It's by no means comprehensive. And I have to say the people in this slide are people that I have met, in my short period here at UW-Madison. But every day I meet more and more people, including, Robert, for instance, who is also working on these types of research problems. So it's very nice to see that there is a community around here asking the questions of how we can use this type of technology safely in order to address so many interesting challenges in biology and medicine. So that's all I have for now, and I'm happy to take questions and participate in the panel.
All right, thank you, Juan. So I'm going to ask sort of Rob, you and Juan the first question. In the context of this panel, we're talking about health and global health. And so one of the key things we need to think about is how these technologies might impact healthcare globally. You know, so is there what type of impact do you see AI and this technology having on making healthcare, let's just call it more equitable around the world as a first thing in terms of availability? You know, if you look at the Western world, we have access to these large machines and capabilities that are very hard to find in the developing world. And so there's a lot of inequality. Do you see AI being able to, you know, impact that?
I could go first if you
Yeah,
want.
go ahead. Either one of
Yeah.
you.
So yeah, I'll just say a couple of things. Here's an analogy. We have, you know, like we were just hearing about chatbots and everything. We all use them probably, or many of us do. And these so-called large language models, you know, can do many things, including translating. They could translate from English to Italian to whatever languages, right? And what we've seen initially is that these language systems were very strong on popular languages like English. And for languages that were from smaller communities, not so good. One of the interesting things, though, is that all languages share some common structures and so forth, and how languages work. And what happens is these large language models can leverage what they've learned about English and French and Chinese and whatever. And then when we have a less popular language that's used by a smaller community, some of the knowledge that these systems have learned about other languages is actually useful for building a system that can also translate to this less well-used language. And so what I'm thinking about is a system where we have lots of information in highly developed countries, electronic health record systems and so forth, and maybe in some other less developed countries that record keeping and so forth isn't as prevalent. We have smaller pools of data from these populations, which are similar but different than the ones in the United States or in you know, Germany or wherever. And so how can we take those systems that have been really fine-tuned on the wealth of information we have in developed countries and then adapt them, customize them to serve communities in other places where they have less information? And there's a real possibility for that kind of transferability of AI. And we might not need to have so much data to make it really work in a developing country, because we can leverage some of the knowledge that's been gleaned from these other places. So that's one example. And then I will just mention in the imaging, we saw how AI can accelerate the imaging. That makes the whole system less expensive to operate, because you can, you know, see more patients with it and so forth. And then, you know, also in terms of this personalization and so forth, that's another example of this kind of transfer of information taken from all sources and then using it to adapting it effectively to new people and new communities. So I think that's one way that this will make healthcare more accessible and more available across the entire globe.
Juan, would you like to add anything?
Yeah, I think, I mean, I completely agree with Robert that one of the hopes of AI for, you know, tackling these types of problems relies on the generalization abilities of those, you know, systems that can expand and transfer that knowledge to situations in which we don't observe so much data. And certainly in, you know, biology, we see a lot of genetic variation, for instance, in which, as I mentioned in my slides, cancer can be very, you know, or deeply personal. The type of mutations that you have are not necessarily the ones that another patient may have, and transferring those, successes to new situations requires either a lot of experiments that can, take a long time in the lab, or some, learning that we make from that situation and transfer it to another situation. And this could help us even in situations in which, equity is not necessarily just about the geographic locations, but also the type of diseases that you have, like people having rare diseases in which there are only 3 or 4 cases around the world are never going to, have the same amount of data as other types of diseases that are more prevalent, and also having the ability to, transfer those situations and that knowledge to those specific conditions may also help give those patients some hope as well. So there are several, axes in which it can help us level out the, the field for different conditions.
There's a great question in the chat. Taking what you've just talked about, both of you, in the collection of data and assuming that there's more prevalence of data being collected in certain populations than others. Is there any risk that instead of equality, you actually amplify the disparities because the data itself doesn't reflect the population as you try to create, those solutions? And so, in other words, will AI make a mistake because you're taking data from one population and trying to apply it to another population, and it's not the appropriate solution?
Yeah, I mean, I think that's a real risk and a concern. We've seen this sort of situation in other systems, for example, face recognition and so forth, where they're trained on largely white populations, and then they do, really terrible things with people with darker complexions and so forth. So this is something that has been front and center in the AI research community for the past, 5-10 years, and we've made a ton of progress. It doesn't mean that, everything's fixed and it's all rosy now, but the awareness of these issues, how to deal with them, how to compensate for them in systematic and formal ways is coming along. So while that is a fantastic question and it's a real concern, I'm optimistic that because of the awareness and because we've developed theory and methods to try to mitigate those types of problems, we'll be able to have successes, and it will do more positive than harm as we go forward. But we have to be vigilant about it for sure.
Great, thanks, Rob. And Juan, I have a question for you, which is to deal with implementing these systems in, developing and let's call them middle income countries, so outside of the United States and Europe, let's say. Are there challenges with knowledge and ability to help people learn how to use these systems in these other countries? Will we be able to roll out solutions enough? Will people know how to use them in these other places as we think about global health?
Yeah, that's a great question. I think there is definitely, communities in every country that are trying to bring in that type of knowledge and opportunities for their communities. And I think that has been seen all across the globe. For instance, in Africa or South America, there are universities that are kind of connected to larger networks of genomics research, for instance, and also machine learning research. I believe they are kind of perhaps one step behind in terms of infrastructure and in terms of, the reach that they can extend to the larger community. But there are definitely places in which they are trying to keep up because they recognize the value. In fact, in some of those communities, there is sometimes already infrastructure that we may not have in our, developed countries. For instance, I remember in Colombia, which is where I'm from, there was a network of telemedicine already in place, like 20 years before the pandemic, because reaching certain places in those geographies is kind of difficult to do. And there are not sufficient, medical doctors in every town, but they were ingenious enough to create that type of network in order to support those communities. So even though in certain aspects they may be one step behind, they are also trying to think creatively in order to bring these technologies, to their communities. And I'm hopeful that they are also going to be receptive about, artificial intelligence models that can help them even extend those benefits further.
That's awesome. And I love your example about how telemedicine in Colombia was more advanced, say, than it was here in the United States. I witnessed the same thing. I lived in Australia in the 1980s, and there were very remote communities there, and they had flying doctors that would get in planes. And I mean, Australia is a relatively wealthy country, but it's that innovation, the notion of what do we need in our society to solve these problems, and it's happening everywhere. I saw the same thing slightly different in China as I was working there in the 1990s. They didn't have landlines everywhere, so but cellular phones were starting to become popular. So they just skipped over the entire landline deployments and went straight to mobile phones. And so some people never knew what it was like to have a landline. The first phone was a cell phone, and that's a reminder for us that we have an opportunity in the developing world to skip right to some beautiful things that we know are possible and deploy that way. I was recently moderating another panel on AI, and there was a huge concern about sort of safety and privacy and these things. And both of you addressed it a bit in your discussions, but how should we think about that, and how will that change in say 10 years and 20 years? And Rob, you talked about the community being very aware of bias earlier. Safety and security perhaps is even a greater concern. Will that get worse as AI becomes more capable, or will that get better? How do you think about that?
Well, I mean, if by safety, I mean, let's just talk about security and privacy. How did we work with electronic health records? And this was in partnership with the Marshfield Clinic. And we had to think it through, like how are researchers going to access that data in a way that's secure and private? And they built an entire system to deal with those issues. And what it meant is basically any analysis, AI, machine learning that we were doing with that data was all happening in their system behind big firewalls, so that no information was leaking out or coming out at all. And so I think that, as we move into these realms where AI can play a bigger role, at the same time, people are building up the technology to make sure it's secure, privacy is maintained, and so forth. Again, it's a constant battle, like, unexpected things happen, but, it's a big research area in and of itself. Just how can we create these computational infrastructures that can make use of all of this data, make use of individual data in a way that maintains security and privacy? And so that's, there's like thousands of researchers focused just on that. And so, I'm, again, confident that we can work these things out. And there'll be hiccups along the way, and then we'll quickly try to correct, right? But hopefully those will be minimal and not too damaging. And yeah, it's a big focus. So I'm generally an optimist about all this stuff, but I'm also realistic.
Yeah.
We'll make some mistakes along the way.
That's awesome, Rob. And I might add, for those, especially from the UW-Madison community here, that that one of my colleagues here in the School of Computer Data Information Sciences recently joined us from Penn State, moved from Penn State to Wisconsin. He's a specialist in security and working on AI issues together with several graduate students. All came with him. And they did that because of the reputation of UW-Madison as being just this fantastic place, not only for our skills in the area that Rob is one of our leaders in, but also for the School of Medicine where Juan is. And the fact that we have these together in one place, which is not something that's common. Many of our peers don't have both the School of Medicine and the technology folks in the same location. So we have an opportunity at UW-Madison to do something that's very special. And those of you in our community should feel very proud that we're one of the world leaders because of the breadth of excellence that we have here at UW-Madison. So.
Yeah, totally.
Juan,
And Tom, if I could just add, I also think the points you just made illustrate why universities play such a crucial role going forward, because Google's and Facebook Metas and those, they don't have a medical school and engineering and computer science and the humanities all in one place. We're the only part of society that can tackle some of these issues effectively because we have all these disciplines collected together in universities. So it's a great opportunity, a great privilege to play such a, I think, an important role in society and AI, something that the big companies can't do and won't.
Well, that's awesome, Rob. I had a colleague just a couple of years ago ask me, why is it important that we have research universities? And I think you just nailed it. You know, you just said, this is why it's important to have research universities. And I might add as well, we're not interested in corporate profits. And I came from the corporate world. You know, this is about really doing things that improve society and humanity. Juan, we have another question from the chat, and it deals with something that you may be able to relate to. You know, that cultural and social norms are different as you travel around the world, and yourself coming from outside of the United States, outside of North America, you can appreciate those different cultural and social norms. Are we expecting too much in terms of what AI can do to adapt to social norms in these countries, not just languages and different, let's say, peoples and populations, but what about the impact of social norms and cultural norms on AI and how we work with it?
Yeah, so if I understand the question correctly, it's the role of social norms in healthcare, I guess, for adapting these types of technologies. I think there are certainly, you know, differences in terms of cultural norms at all levels, including, for instance, the legislation and the type of access that governments provide, you know, to their citizens in terms of healthcare, whether the information is centralized or private to certain entities. So that also makes a difference, especially when we're talking about AI. If one AI system is able to get all the information from the entire population versus having access to only certain records, whether that information is, you know, private for a for-profit entity or it's public for everybody, I think the regulations definitely differ. And I think this is also something that we are discussing even in developed countries. So that is one layer of the cultural norms. I think another layer is whether the population accepts or, you know, feels comfortable receiving this type of treatments, depending on their beliefs and in their experiences. Maybe they prefer to have, you know, something that is not AI-based, you know, and that may be a choice that patients have to ultimately decide as well, in terms of, you know, for instance, this cancer patient that I was talking about, she was willing to, you know, accept experimental treatments and so on. But there are other patients that prefer to just let it go and let happen whatever disease they have and accept the situation. So I think the same could be true for AI. Instead of forcing those types of decisions to be made with automated systems, the patient should have a say into whether they want to receive certain recommendations or diagnoses or treatments. So keeping them informed is important, because it changes from their cultural backgrounds, their beliefs, and so on. So I think that's a great question, and it applies to multiple levels of discussions.
Yeah. Carrying further into that question, Rob, are there, as AI models are being built out, are people building these cultural and social norms? How are AI models dealing with those things? In measured or unmeasured ways is the way the question was worded.
Yeah, I'm not 100% sure on the measured and unmeasured differences in modeling AI part of the question. If the person elaborates, maybe I'll try to address that. But I think it's, that's a great question. Like, there are different cultural norms and so forth in different populations. And the first step, usually, in rolling out technologies and getting them in use is education, right? Explaining to people about that technology. I mean, there's good, some bad track records of certain technologies and certain industries having bad effects on, say, socioeconomically less privileged classes of people. Like, they put an oil refinery near the poor neighborhood or something like that. And so there's skepticism out there, and rightly so. Like, I think everybody should say, like, hey, is this for me? Is this going to be helping me or not? And, we can't just sort of force this onto people. We have to sort of say, hey, here, and I think we can do that kind of education and outreach, and also make sure that we are fielding this technology in a fair and equitable way, and not sort of saying, oh, these people get a real doctor, these people get an AI doctor. It's not, we can't have that sort of thing going on. So I think that it's a tricky issue. And so, to answer your question, like, what are we doing to adjust AI to different cultural norms and so forth? I think that's an ongoing process. I mean, and I feel that that's really in a nascent stage. We haven't thought about how systems, for example, for healthcare need to be adapted or customized to different populations of people who are coming from a different place with different norms, different expectations. And again, I would say the first step is sort of education about what it is and isn't doing, what possible risks there may or may not be. And that takes a while. But we have very effective people on campus just for that sort of thing, in mass communications and journalism schools, where they look at how do we communicate about technology and science to people who aren't technologists or scientists. We have to do this all the time. I'm not an expert in it. I hope I'm doing an okay job today, but we really do have people, and this is what they study. How do we hear from those people? How do we get their voice into the conversation so that we can adapt our science and technology to best serve them? This is a big part of what we do here at Madison too.
That's a great segue to talk about one other initiative that we recently announced here at UW-Madison called RISE. And the first sub-initiative under RISE called RISE AI, which is about hiring dozens of new faculty in AI across the entire university. So Rob talked about them being in mass communications and journalism, as well as in social sciences, population health, everywhere, not just in the areas that Rob and Juan represent, but something Madison is keenly committed to and strategically developing a capability, world-class capability, as one of the leading tier 1 research universities in the world, but even more of an emphasis around AI. So exciting time for the field that we're in here. I have one quick question from Jorge, and then I have a final question I'd like to pose to the two of you as we wrap up here. The question Jorge asks is about intellectual property, and certainly in the let's call it the written world, we know that these large language models, some of them have built by crawling the web and building up information that way, and sometimes taking proprietary information and consuming it and now regurgitating it. Is there any risk in the healthcare side of things that large language models or some of this AI work will be dealing with intellectual property issues that might impact the quality of care? Anybody, either one of you.
So I think we've seen issues around intellectual property with chatbots, right? They've ingested my research papers, my colleagues' textbooks, and so forth. I mean, and now all that's in ChatGPT. Is that a fair use of that? Should I be compensated because it knows about my research papers? These are good questions. Now, when we go to AI technology in medicine, of course, we've talked about how we want to take all the data we have and use it to make the most powerful and effective AI systems to help doctors in healthcare. And yeah, I think this is an issue. I don't know. I'm just thinking about this is the first time I've thought about intellectual property. Like, hey, we're using all of GE's brain scans, and then we also got them from Siemens in this hospital and another hospital. Whose data are those? How do we share those data to build these AI systems, but in a way that kind of compensates people for all the expenses they went through? We could go to the Marshfield Clinic. They had to hire all kinds of people to manage this system, all the doctors in their health network. I mean, is that data just now supposed to be turned over to OpenAI so they can build an AI system that takes all that investment that Marshfield Clinics put in over decades? And how do we make those arrangements? I think I'll leave this to the lawyers. I think they'll probably work it out. But yeah, it's a great question. I mean, how do we share information, again, privately, securely, all that sort of stuff, but also in a way that makes sure it's fair for everybody who's invested in gathering medical data over the years and so forth. So yeah, I guess we'll see how that pans out, but it'll have to happen.
So my final question for both of you, each of you, and I'll give just 1 minute each to think about it and 1 minute to answer, and I'll start with my own. And the question is this: if you had a dream of what this could be, AI could be in another 10 years, what would that look like? And so I am going to kick that off. I finished my industrial career in an open source software company, and I believe in open source and open data. And one of the things you mentioned, Rob, is the notion of the value of this healthcare data to the general public. And if I had a dream that in 10 years' time, it would be that all the owners of healthcare data collaborate on creating one open database that's secure and private, but allows everyone to benefit in society around the world from the existence of this data so that we can improve health outcomes everywhere. And that would be my sort of one dream in 10 years' time of something we might see. So with that in mind, Juan, what might your dream be for outcomes in 10 years' time?
Yeah, that's a great question. My research is more in the preclinical side of things. So for instance, in drug discovery and functional genomics. So I hope that, in 10 years or so, we can have models that understand cellular biology in the same way that our current chatbots understand language. And what I mean by understanding is like really all aspects of cellular and molecular biology, including gene expression and the proteins of cells and the organization of cells, cell morphology, and how cells interact with each other. So having that type of model that comprehensively understands all the nuances of how the cells work and why they make the decisions they make is hopefully going to help us personalize medicine more accurately and design treatments more specific and more effective. So that is my hope for the next 10 years or so.
That's beautiful. Thank you, Juan. And Rob?
I've always been intrigued with the idea of the robot scientist. And I'd like to see AI systems actually playing a role in discovery in medicine and healthcare. And one way that could happen is we know how complicated the human body is, and we have experts who are specialists in different parts of that system, the human body, but we know it's all connected. And it's very hard for any one doctor to be an absolute expert in all the systems in the human body and how they all interrelate. And I do think that AI could play a role as a facilitator between different experts. Say you have some patient who has different things, you bring in the experts, right? But maybe an AI system could also be in the room helping see connections that maybe are harder to see from, so I think, AI systems have a potential to have a different complementary benefit to, healthcare and also discovery medicine that can augment the capabilities of interdisciplinary human teams of researchers and doctors. That's what I'd like to see.
That's awesome. Thank you both. Jorge, over to you.
Well, thank you so much, Tom, Rob, and Juan, for what a wonderful discussion. I think this was very exciting and very enlightening for all of us. I also want to thank all the folks that joined the webinar. And please be tuned for our April 10 Global Health Symposium that is in collaboration with the Office of Global Health of SMPH. So thank you so much to everyone and have a good rest of the day. Thank you.